Hi, everyone. We are going to get started in just a moment. We're going to let a few more people join, give them a little more time. Okay, it's 2:02, so I think we can hop into today's meeting. Um, so as you know, we're meeting today to discuss the Choices Waiver Amendment, and thank you for joining. Um, Before we do that, um, we just wanted to introduce the Department of Human Services team and their partners at A&M or Alvarez and Marsal. And I can go first. My name is Ben Keschner. I am a analyst at Alvarez and Marsal, and I've been working with the South Dakota Department of Human Services since March. So for just about 8 months. And it's good to be here with everyone today. And I know we have a lot of members of the Department of Human Services on the line, so I'll let them introduce themselves as well. Maybe Jenna, if you'd like to go first.
Sure. Good afternoon, everybody. Thank you for joining. My name is Jenna Howell. I am General Counsel for the Department of Human Services, and I have been assisting in both the rules process that led to this amendment and then just sort of the legal aspects of the waiver. And I'll share with the group a little later just the actual amendment and precisely what's being changed.
Hi, everyone. I'm Carrie Geffert. I'm the Family Advocacy Coordinator for the Division of Developmental Disabilities. And Cade, you can go next.
Kate Anderson, HCBS Operations Manager.
Great, thanks everyone. And if you're comfortable, you can write your first name, your town, and your role in the chat. So for example, Kate Sioux Falls mom, if you would like to introduce yourself. Um, and today, we would like to talk about the Choices Waiver Amendment. And of course, we would like to hear your feedback and answer your questions. And as always, our goal is to provide high quality and reliable services that meet the assessed needs of people with intellectual and developmental disabilities. So before we do that, we wanted to give everyone an opportunity to sign up for the DDD listserv. I am sending a link in the chat here if you have not yet signed up for it. You can sign up for DDD emails about a variety of topics, including the choices waiver. So if you haven't yet, that is a helpful resource, and the link is in the chat. So uh, would definitely encourage you to sign up. Additionally, you can at any point throughout the meeting today submit a question either out loud or through the chat. But if you feel more comfortable doing that anonymously, you can use our anonymous Menti option by scanning that barcode on the screen or entering that code there, 12403960 into menti.com. I've sent that in the chat as well, so you can scan the barcode or use that code anytime to ask questions anonymously if you don't feel comfortable asking out loud or through the chat. So before diving into the Choices Waiver Amendment, it's important to take a step back and to talk about the Choices Waiver itself. And more broadly what a waiver is. So, a waiver is a special sort of permission that Medicaid gives to states that allows people with significant health needs to get the services and supports that they need in their own homes or in a community setting. And the goal is to keep people out of living in a state institution. And so a waiver gives states more flexibility around the services that they use and that are provided, and how states provide them. Getting a little more specific, the Choices Waiver is an HCBS, or a Home and Community-Based Services Waiver. And so an HCBS waiver provides Medicaid funding for home and community-based services, or HCBS. And these services are provided in a person's family, uh, in a person's home or community, or their family's home or community. A person must be eligible for Medicaid, and they must apply for an HCBS waiver program to have access to these services. And just to reiterate, as it says on the bottom, an HCBS waiver helps people use services in their homes and their communities, or their families' homes and communities. And so, diving into the Choices Waiver specifically, the Choices Waiver is a home and community-based services waiver program that provides services to people with intellectual and developmental disabilities in the state of South Dakota. And the Division of Developmental Disabilities, or DDD, which is part of the Department of Human Services, DHS, oversees this waiver. And so, under the Choices Waiver, people with developmental disabilities across the lifespan can receive services, which really just means people of any age can receive services. Participants must meet eligibility requirements, both financial requirements and medical requirements. And it is a traditional waiver program, which means that it is not self-directed, and that providers and states are in charge of how services are administered. And services, of course, include case management, residential habilitation, supported employment, vocational support, career exploration, day habilitation, medical equipment and drugs, and assistive technology. And that is not inclusive of all programs on the waiver. And if you'd like to know more, DDD has helpful videos and resources for families and self-advocates that do a really good job of explaining the Choices Waiver, and also the Family Support 360 Waiver. So I'm sending that link in the chat now, and you can use that link to learn more about the Choices Waiver if you so choose and you're interested. So before we dive into the Choices Waiver Amendment, we wanted to leave time for any questions about that overview or about the Choices Waiver, if there are any. All right. So, what is a waiver amendment and what is in the Choices Waiver Amendment? An HCBS waiver amendment is a change that you make to an HCBS waiver, which is flexible. So once the base application for a waiver is approved, it can be amended or changed. So to begin, a state submits an initial HCBS waiver application to Centers for Medicare and Medicaid Services, or CMS. And once it's reviewed and approved by CMS, it's approved for 3 years. And if there are no changes to this initial waiver, waiver renewal is approved by CMS for 5 years. And this cycle continues until a state decides to either terminate the waiver, which CMS can do as well, or until a state decides to amend or change parts of the waiver. And at any time, a state may want to amend or change a waiver in order to adjust the approved program, add new service types, adapt to new federal regulations, start new service delivery models, expand eligibility, or adjust funding and adjust service rates. Um, and of course, it's important to note that state agencies, people participating in the waivers, their families, and the service provider community can advocate for waiver amendments or changes to the base waiver. So I'm going to pass it off to Jenna to discuss what's in the Choices Waiver Amendment specifically.
Thanks, Ben. And I am actually going to just share the one page. This is a very simple amendment, the purpose of which is to change the definition of qualified provider. So, as many of you know, in this last fall in 2024, we brought a rules packet that changed the rule on out-of-state providers, which said currently, or previously, I should say, the rules said that out-of-state providers would have to become South Dakota corporations and be registered with the South Dakota Secretary of State in order to provide services. Now, in some cases, families and self-advocates prefer to get services out of state, particularly, around some of our border towns. Services might actually be closer in an out-of-state setting than in a South Dakota setting. But our waiver was a barrier to that and our rules because of the requirements that those entities become South Dakota corporations. So we changed the rules last fall, and then once our rules changed, the next step was to change the waiver. So what I have brought up here is what is already posted. This is the full waiver with the amendment language included. It is posted on our website. And I'll just cut to the chase for those of you who don't want to look through all 206 pages. The main change is on page 92. As you can see highlighted here, the old language said a qualified provider has to meet the nonprofit corporation requirements and everything of our laws. SDCL is the South Dakota codified laws, excuse me. But what we added here was this exception, unless they are seeking to provide services to participants in a state other than South Dakota, in which case they may provide evidence that they are an approved provider in good standing in the state in which services are being provided. So that way we can provide direct services through the Choices Waiver to providers who do not provide services in South Dakota if we have a participant who wants out-of-state services. This is entirely voluntary, absolutely no pressure at all on participants or their families, but it is an option. For those, again, like I say, maybe live up in Perkins County and the services are sometimes closer, I know, in North Dakota, or live, down by Sioux City, Iowa, and it's closer there, or Nebraska. So just want to emphasize that this is a very simple change. We view it as positive for everyone in the program because it just creates more options to be reviewed and potentially more service providers in those limited cases. I do want to say that this is not, one and done. There are a lot of CMS requirements for out-of-state placement. They certainly recommend it as a best practice, but there would still have to be a lot of paperwork, negotiations, and planning for an out-of-state placement. But this opens the door and makes that a possibility. So, because that is so short, I will stop there. Any questions on this specific extended sentence? Yes.
This is Deb Moore from Kadoka. I'm Mitch Moore's mom. And I had a question. We're looking for our son Mitch, or looking out for him for when we're not able to help him. And we have a son in Cedar Rapids, Iowa, who would probably be guardian if we weren't able to help Mitch. Would that include something like that where he could be a provider from a distance like that?
That would probably fall, I think, more under family support than choices. So I don't know that this would be applicable to that situation.
Okay.
But please feel free. We can talk, more specifics offline. Please feel free to reach out.
Okay. Thank you.
Absolutely. Thank you for the question. Anybody else? Well, certainly Ben has shared all of our contact information, the listserv. I'm sure you all know how to get a hold of Dee Dee, or me. So please don't hesitate to follow up if you have any questions after the presentation. Thank you.
Yeah, and I just sent an email in the chat that you can email at any time if you have any questions. So, moving forward to the choices waiver amendment timeline, we have gotten a decent amount of steps done in amending the choices waiver, and we are now in the public comment phase. So first, DDD had to alert DSS to the proposed choices amendment and tell stakeholders about plans for that amendment. Once DDD updated the choices waiver and submitted the waiver to South Dakota Medicaid for approval, they gave public notice on December 10th and are currently in the process of allowing for public comment, which ends on January 10th. So once that ends and DDD receives public comment, they incorporate those comments into the new waiver amendment, and they submit that amendment to the Centers for Medicare and Medicaid Services, CMS. And once CMS approves that waiver, then the waiver amendment is complete. So diving into the public comment process more in depth, the public comment process is really just an opportunity for anyone in the public to provide feedback and ask questions about the new choices waiver amendment, which is required by CMS. So first, the state must publish notice and the amendment itself. And the Division of Developmental Disabilities published this amendment and the public notice on December 10th of 2024. Next, there is at least a 30-day comment period, and this comment period opened on December 10th when that notice was published and is closing on January 10th in just about a week. And once that public comment period closes, the state must summarize and respond to comments in the waiver. And once they do so, the state or DDD submits the amendment to CMS for review. And of course, it's important to note that DDD and DHS both want to hear from you, want to hear from the public. And so in addition to the CMS requirements, DDD is sharing information about the waiver amendment by email and on the Department of Human Services website. And additionally, they are hosting town hall meetings to share information about the changes and take public comment live, like the town hall meeting we're on right now. And so that is the end of the presentation and content on the choices waiver amendment. But if you have any questions or comments for anyone with DDD or DHS, please do not hesitate to ask.
So Ben, I see there's a question in the chat from Michelle. Does this bring more CSP choices to South Dakota for participants who do not choose to have their services out of state? The very simple answer to that is no. This does not, this particular very narrow change only applies to providers who would be providing services out of state. Deb, I think your hand is up again.
No, not me.
Oh, okay. Sorry, it showed on my screen as having your hand raised. Anybody else?
Okay, you know me, Mary Kay. I just want
Mary
to
Kay,
say
how are
nice
you?
job. Um, I think this probably won't benefit a lot of families, but the ones that do really needed it. Um, thank you. Thank you for doing this.
Oh, very glad to. Yes, this is one small step of the many steps the division is taking to try to increase options and services. So
Yep, we
you're very
appreciate it.
welcome.
Thank you.
Thank you. Well, with that, Ben, I don't know if we have to keep everybody. Ben shared all of the links, and of course, you have the email as well. If you have think of any questions afterwards or want to talk with us offline, we're happy to do that. So, thank you very much for coming and listening to our update on our very short, but we think important Choices Waiver Amendment.